defined as the bleeding from or into the genital tract after the 28th week of pregnancy, but before the birth of the baby. Important point is the 28 week. After 28 week of pregnancy, we can call as antepartum hemorrhage. Okay, the incidence is occur due to the lower limit of fetal viability. The incidence is about 3% among the hospital deliveries. Causes of antepartum hemorrhage. Here the graph you can see. There may be the placental bleeding, which causes due to the placenta previa or abrupto placenta. Unexplained means idiopathic cause. Extra placental means cervicovaginal region, cervical polyps, carcinoma of cervix, varicose vein, local trauma. Now placenta previa we will discuss. What is placenta previa? Placenta previa is that the implantation of the placenta is partially or completely lower uterine segment or uterine that is adjacent to the internal OS. Internal OS का adjacent में placenta implantation होने से उसको कहते हैं placenta previa. Why it is called previa? Previa terms denotes that the placenta position relation to the presenting part. Okay. Now the incidence of a placenta previa. 1/3 of the case of the antepartum hemorrhage is due to this placenta previa. Okay. In 80% cases, it is found that multiparous women, the incidence is increased if the multiparous women having the pregnancy beyond 35 age, then it leads to the placenta previa. Increased family acceptance with limitation, lack of spacing between birth lowers the incidence of the placenta previa. Now the causes of placenta previa we will discuss. Okay. So what are the causes of placenta previa? So it is not exactly known, but there is some theory, that is a dropping down theory. Dropping down theory says that during the fertilized ovum, if drops down and implanted in the drops lower segment, there will be residual reaction due to the upper uterine segment, which leads to the zona pellucida, failure of a zona pellucida disappear in that time. This is a hypothetical possibility. It is not sure, but here says that residua always formed in the upper part of the segment. But if the residua is formed in the lower part of the segment, that is abnormally, then it leads to placenta previa. So this is not sure. Okay. Now the persistence of a chorionic habit means the decidua capsularis. When uterus there will be implantation occur, we call decidua. Decidua has two parts: decidua basalis and decidua capsularis. Capsularis is the covering part, basalis is the lying part or basement part. So decidua capsularis, where the subsequent development of a placenta is comes in contact with the decidua vera of the lower segment, can lead to degree of a placenta previa. Okay. Now the defective decidua. What is that? This is result due to the chorionic villi over wide area of a uterine wall get nourishment. Means chorionic villi is now spread wide area of the uterus, which results during the process of the placenta do not develop well. There will be such placenta previa underlying myometrium causes placenta accreta or increta or pecreta. Okay, this is types of a defective decidua. Now big surface area of a placenta as in twins may. Due to the twins also there will be the placenta previa can be occur. This is also another cause. Then what are the high risk factor of the placenta previa? What are the high risk factor? One is that multiparity, increased maternal age, previous cesarean section if occur, then the scar tissue which is remain in the uterus, which results in the enters into the uterus and which causes also the placenta now due to the remaining of the scar tissue which causes this thing. Then placenta size, smoking causes placental hypertrophy, and these are the physiological causes or etiology. Now the pathological anatomy of the placenta previa. How can placenta is seen in the anatomical position? The placenta may be large or thin. It is often tongue-shaped extension from the main placental mass. Extensive degeneration of the occur due to the infraction and the calcification. Placenta may morbidly adherent due to the formation of a pore decidua formation in the lower segment. Okay. This is the thing that lower segment placenta into three things you should always remember. One is that lower segment of the placenta adhere. Another thing is that the scar tissue formation or there will be multiparity. These causes are causes the etiology of the placenta. Umbilical cord, how the role? If the cord is attached to the margin of internal os, there will be the insertion of a cord into the internal os, which results the Velmentous insertion gives rise to vasa previa, which rupture along with the rupture of the membrane. This leads to the also placenta previa. Lower uterine segment, what it causes? Due to the decrease in vascularity in the lower this results the cervix more soft and more fibrous. That's why also placenta can rupture occur easily. Then types of placenta. There are mainly 4 types of placenta previa is divided according to the degree of extension of a placenta to the lower segment. Okay, now you can see the picture. What are the showing picture says that there will be Type 1, what happened? The major part of the placenta is attached to the upper segment. Here, the upper segment, major part is attached, and only the lower margin is here. You can see this lower margin is now enclosed to the lower segment, but not up to OS. Not only OS margin get attached by the one side of the placenta. Now, type 2 is the marginal, where margin of the internal, but do not cover it. Here you can see only margin, there is no covering. But in 3 and 4, you can see this is half partially covering, this is full totally covering. So that 3 and 4 is commonly called as a placenta previa. Type 3 and type 4 is most commonly known as a placenta previa nowadays. So these are the for clinical purpose that is occur, that is a type 1 and type 2. This is milder, and major mainly type 3 and type 4. Then dangerous placenta previa. What are the dangerous placenta previa? So dangerous placenta previa is that the placenta it is named as why, because of the curved birth canal. Major thickness of the placenta is about 2.5 cm during the sacral promontory, but anterior-posterior diameter of the inlet and prevents the engagement of the presenting part. As because of the placenta is now shortage to that area, so that the diameter becomes shortened, and which causes the engagement of the fetal head very difficult due to the placenta previa. So this hinders the compression of the placenta, and that's why the placenta is more likely to be compressed if vaginal delivery is allowed. If vaginal delivery is allowed, then there will be placenta, maybe more compression can be occur. More chance of a cord compression or cord prolapse can occur. These two may causes death of the mother. Why? In the placenta previa case, bleeding occur. So bleeding because of the placental growth occur. Slow placenta when never grow, it will become due to its implant on the lower segment of the uterus. That's why whenever it undergoes growth, it comes down and down slowly in latter month, and this causes the dilatation of the cervix. And due to the inelastic property of the placenta, there will be uteroplacental vessel and leads episode of a bleeding occur. As in a physiological, this is a phenomenon. This separation of the placenta and bleeding is said to be inevitable. Bleeding will be definitely occur. However, this separation of the placenta may provoke the trauma of the if at that time the vaginal PV occur, then it leads to the trauma can be occur. Also, if any coital work or any type of thing causes rupture of the membrane, the blood is always maternal blood comes out. Although fetal may escape from this turn, but this causes the placenta separated from during this trauma. The mechanism of spontaneous bleeding, that is thrombosis occur of open sinuses, mechanical pressure will be occur in the presenting part, then placental infection occur. These things causes the spontaneous control of bleeding. Then we will discuss about the important topic, that is placental migration. If we see in the USG, there will be in the 17 week placenta covering the internal OS about 10% case. But if we take at 37 week, there will be no placenta in the lower uterine segment in more than the 90 case. But in the lower uterine segment expand from 0.5 to, that is 10-fold from first term. So the term placental migration means two way, that is the progressive increase of a lower uterine segment, that is lower placental eggs is located in the cervical OS or trophoblastic tissue towards the fundus. This resolution causes placental previa. These are the ultrasonography. You can what you see, these things are written. Now clinical feature of a placental previa. The only symptom is that vaginal bleeding. The classical feature of a placental previa is a sudden onset, painless. Important thing is that in placenta previa there will be painless, but in abrupto there will be painful, tenderness. Okay, this thing you should always mark. There will be painless, pauseless, and recurrent. These three things are important in the clinical picture. There during the labor, there will, if a prima gravida occur, this can be occur. If there is a history of a warning hemorrhage, is usually slight, but the bleeding is unrelated. If occur during sleep and patient become frightened, found himself full of blood. The bleeding is unassociated with the pain unless the labor starts. Bleeding never associated with the pain because of unless until the labor pain start, then the pain will be appear. But except labor, there will be no pain. Okay, these things is written. That the important thing is that obvious cause of a placental separation causes trauma, which or hypertension are usually absent. So, however, the preeclampsia can complicate the placenta previa. So, first thing we used to that bleeding is not alarming, but subsequent heavier previous one due to the separation of a fresh area of the placenta, which leads to bleeding occur before 30 weeks, and earlier bleeding more likely to occur major degree. However, it is may not be bleeding in the center placenta until the labor starts. Asymptomatic cases detected by the sonography at the time of a cesarean section. Okay, these are the things what you see in the clinical picture. What are the signs? There will be the sign mainly anemia and visible blood loss. That's why if there will be pre-existing anemia may occur with hypertension can be found. Now the size of the uterus is proportional to when you think that placenta previa, it may be if during the abdominal examination, if you see that the size of the uterus is not proportional to the period of gestation, the uterus feels relaxed, soft, elastic, inactive without any localized area for tenderness. Persistent malpresentation like breach or transverse and unstable lie is more frequent. There is increased chance of a frequency of twin pregnancy. The head is floating in contrast to period of gestation. Then fetal heart sound, you can see in the Doppler there will be slowing of a fetal heart rate on pressing the head down into the pelvis. Okay, and but the sign is not always significant. But then vulval inspection, you can see the placenta previa, the blood is bright red due to the loss of blood, which you see this is more brightly, and there will be uteroplacental sinus can be seen in the cervical opening. Vaginal is must not do not don it without anesthesia. Then what the things causes the confirmation of the diagnosis? There will be painless and recurrent vaginal dip in the second half of the pregnancy. With sonography, you can see transabdominal sonography or transvaginal sonography ultrasound you should have. So why many people ask that the vaginal examination is contradictory. If that occurs, then how can we do the transvaginal sonography? So transvaginal sonography is that in that time you should only place the probe on the vaginal part. You do not put it inside the vagina. That's why transvaginal sonography is not complicate the placenta previa. Then Doppler probe, MRI is the placenta previa or placenta previa accreta, that is MRI. You can see by internal examination like in Doppler set, that is direct visualization through cesarean and the placenta following vaginal delivery. These things causes the confirmation of the clinically as well as MRI and USG causes the confirmation of the diagnosis of the placenta previa. Now we can see by placentography, that is by USG, you can see there will be the central placenta previa. You can see on one side of the part there will be placenta remain. This causes the Now, important point we should remember that abrupt placenta and the placenta previa. What is abrupt placenta? Abrupt placenta means there will be the placenta which is implanted in the lower segment of the. It is completely a cover of the internal waist, as well as you should remember that there will be the painful bleeding will be occur, and this is always associated with eclampsia, and usually it is maybe as mixed with the placenta previa. Dark color blood, there will be out of proportion of the visible blood and present with 1/3 of the case it is found. Okay, the abdominal examination, you can see there will be according to the gestation or amenorrhea LMP, there will be the abdominal size is not proportional with that LMP. That is the most important thing. There will be the tense and the tenderness and the rigid abdomen, you can see. Then there will be the usually unrelated hair may be engaged. Then placenta is present in the upper segment. Placenta is not felt in the lower segment. Blood clots should not be confused with the placenta. These are the abrupt placenta part. And what are the placenta previa we will discuss. But in the abrupt placenta is more dangerous because it is painful, and within 2 to 3 hours, if you do not executed by plasma by platelet therapy, there can be DIC occur. Okay, what are the complications? I want to study read about all those malpresentation if occur. There will be rupture of membrane, can be cord prolapse, slow dilatation, intrapartum hemorrhage, postpartum hemorrhage, retained placenta can be occur, low blood rate occur in the mother, and if there will be abrupt, there will be the sepsis occur. These sepsis, that is DIC, can be found. These are the thing, and these are the point. So abrupt placenta is that placenta which is the